Welcome to Evidence Based, a new Harbinger psychology podcast. I'm your host, Cassie Stossel. On today's episode, we're talking about maternal anxiety and OCD with Dr. Jenny Yip, author of Hello Baby, Goodbye Intrusive Thoughts. Jenny has fought her own personal battle with obsessive-compulsive disorder. Inspired by her childhood struggles and motivated to help others, Yip established the Renewed Freedom Center Los Angeles in 2008 and Little Thinkers Center in 2016 to provide cutting-edge treatments for children, parents, and families. Yip is on the board of directors of the International OCD Foundation, IOCDF, where she facilitates the Perinatal OCD Task Force and is a clinical fellow of the Anxiety and Depression Association of America, ADAA. A sought-after speaker on mental health, family dynamics, pediatric development, and maternal wellness, she has delivered numerous impactful presentations around the world. Yip has received several prestigious awards recognizing her invaluable contributions to the field. Renowned as the go-to expert, Yip is a regular guest on television, print, podcasts, and national radio, drawing on her extensive 20-plus years experience in evidence-based clinical treatments, teaching, and research. In an effort to raise accurate awareness, eliminate mental health stigmas, and provide practical parenting tools, Yip is tirelessly involved in various projects to provide effective strategies for a stressless life. Her most paramount endeavor lies in nurturing her twin boys to live compassionately, empowered by healthy and meaningful boundaries. Hi, Jenny. Thanks so much for joining me today.
Thanks so much for having me, Cassie.
I think this is such an important conversation to have, and I'm really glad that you joined us today. And I thought we could start off our conversation by just talking about why is maternal health so important and what are some common mental health issues that perinatal and postpartum mothers face?
So I know we keep throwing this word around, maternal health and maternal wellness, except I think why it's so important, especially right now, is because we're realizing that there's such lack of attention focused on maternal health and maternal wellness. Even in my book, I clearly state that if you look at the data of what it means, there's still a lot of mothers who don't get the care that they need. We're kind of looked at as this balloon that's supposed to carry this infant, and there's just no attention focused on how well or not well a mother is doing. And even the whole idea of maternal wellness is really a myth, because when you go in for your prenatal checkups, when you go in for your postpartum checkups, there might be one question toward you: how are you? But then that's it. Everything else is focused on the baby or the fetus's, health and growth and development. So unfortunately, because of there's such a lack of attention focused on maternal health and maternal wellness, there's a lot of perinatal illnesses that often gets overlooked, such as perinatal depression is very commonly spoken about, still often misdiagnosed. As same thing with perinatal anxiety and OCD and perinatal psychosis. These are topics that we don't often talk about or even are aware about. So I'm really glad we're having this conversation today.
Yeah, and you've talked about how postpartum OCD is really commonly misdiagnosed. Why is that? And how can mothers lessen that stigma to get the help they need?
So, postpartum OCD gets misdiagnosed very often because number one, a person going through OCD has intrusive thoughts that tends to carry forbidden, stigmatized, dangerous types of content to the thoughts. And therefore, a mother who is going through the intrusive thoughts of potential harm or pedophilia type thoughts to her newborn or unborn is going to feel stigmatized about disclosing this type of thoughts. And of course, you would feel stigmatized, rightly so, because there's a lot of judgment in our society. And a lot of mothers today who do disclose still potentially could get negative consequences, such as being hospitalized for a 5150, which basically means that you're potentially a danger to yourself or someone else, such as your newborn. Or If you disclose the information and someone doesn't really understand it, then baby could be taken from you because you're supposedly a potential harm. And the reason why postpartum and perinatal OCD gets misdiagnosed so often is because people don't realize that OCD in itself means that a person has intrusive thoughts. However, intrusive thoughts doesn't mean I agree with the content of my thoughts. They're intrusive because you don't want to have them, because the content doesn't align with your values and your belief system. And of course, if you don't want to think about it, it's just going to occur even more. So the example that I give to a lot of my patients and whenever I'm training therapists about OCD, it's if I asked you to not think of the yellow duck, don't think of the yellow duck, what is it that you do?
Think about the yellow duck. Yeah.
Except when you're thinking about the yellow duck, you're not thinking about it because you want to have the thought. You're just thinking about it because you're focusing attention intentionally or unintentionally onto the thoughts. And therefore, they're just going to come up even more. So, when you have an intrusive thought of potential harm to your newborn, of course, you're going to tell yourself, don't think of this thought. And then it's going to happen more and more and more. Now, unfortunately, even within the mental health community, there's such a lack of awareness of what intrusive thoughts mean that I have had so many patients who has been hospitalized because of their intrusive thoughts from providers who don't really understand what that means, who don't understand what OCD means. And I know the public believes that OCD just means you check things all the time and you like things perfectly organized or you're constantly washing your hands. And let me tell you folks, that is just a small portion of what OCD actually is. So that when you have mental health professionals and medical providers who are unaware of what OCD actually is, then obviously they're not going to diagnose you correctly. And, unfortunately, many people suffer for a very, very long time before they get accurate evidence based treatments.
Yeah, and it feels really problematic too, like you said, with the stigma that a lot of mothers are suffering in silence because they're afraid to lose baby, be hospitalized, any of these things. And so I feel like that just is going to perpetuate it even more with that stigma coming in at it. And I'm curious, for someone to experience sort of this maternal postpartum OCD, do they likely have a history of OCD prior to this, or does it come up, postpartum, or how does that work?
Unfortunately, there's not enough research to really indicate is there a cause and effect or is it related in any way. There really is not enough research on maternal health and definitely not sufficiently on postpartum or perinatal OCD. But what we do know is that if you do have OCD previous to being pregnant, pregnancy is a vulnerable period, naturally so. You have a lot of hormones that are surging that can affect your serotonin levels. And on top of this, you have this new responsibility. And having a baby is not a small responsibility. It's probably one of the biggest responsibility every single parent has. So, therefore, because of the fluctuations of hormones and the over responsibility that you have on your plate, this is like the perfect storm for perinatal OCD to be triggered. So, I've had many women that I've worked with where they've had OCD from a very young age. And then during their perinatal period, they want to make sure that they boost up on their skill set to prepare for what might occur, which is a resurgence of OCD, intrusive thoughts and fears and worries. And that has been a barrier, to actually suffering from postpartum OCD. So I think it's really important to just know that having OCD previously is a risk factor for having it during your perinatal or postpartum period.
I'm wondering in your practice if you've seen an uptick of, this postpartum OCD and anxiety just based on sort of the world that we're living in, or if it's just been always there and more people are maybe paying attention to it now and getting help, or what's that been like?
Yeah, I don't think there's an uptick. And people ask this question all the time. Is there an uptick in autism? Is there an uptick in OCD? And no, I don't think there's an uptick. I think we're just better at diagnosing what this is. And therefore, if we're better at diagnosing and recognizing OCD for what it is, then it just makes sense that more people are being diagnosed earlier or accurately. And then also, consumers are much more savvy today than we've ever been with social media and just, people also disclosing their own personal journey with mental health conditions. So, because people are coming forth more with their mental health journey, with their postpartum OCD journey, then it gives a voice for this so that other mothers and fathers, might I say, because they also suffer from postpartum OCD, are more likely to recognize it in their own behaviors and more willing to get the treatment that can be a lifesaver.
Yeah, and that's why that awareness is so important.
Absolutely.
At the core of all of this is sort of that fight or flight energy. And in your book, you talk about transforming that into productive energy. Can you talk about how we can do this?
You know, I think we've gotten trapped in a world where we just believe stress is terrible and we can't be stressed and everything just has to be balanced. That's the other thing. The word balance has just gone like so overused that everyone's trying to strive for balance, which is not realistic, 24/7.
Yeah.
However, your body's fight or flight energy is there to serve you if you recognize it as that. If you're waking up and you're feeling your body's energy, that doesn't necessarily mean something terrible is happening to your body. That doesn't necessarily mean that, you can't handle it. How do you channel that energy? What intention you set for that energy is up to you. You can appraise it as, okay, this is uncomfortable, I don't like it, and this must mean that I'm just anxious and stressed out. Or it could be, all right, I'm feeling this way, what can I do with this energy right now? And might I just say, I'm actually right now going through menopausal the menopause period, and I'm constantly feeling my body's cortisol levels and this fight or flight arousal all the time because of menopause.
Hmm.
So now, if I was to feel it every moment when I wake up in the morning and then say, okay, I can't do anything because it's too much for me, I would not be having this conversation with you today because I woke up feeling that this morning, except what intention am I setting for that energy? So the example that I give to all of my patients is if you went skydiving, right? Let's say your friend invites you skydiving. Just before you're about to jump off that plane, you're going to feel your body's fight or flight arousal. So, what does that mean? What it means is that your heart is palpitating. You're feeling maybe queasiness in your stomach. You're feeling the tingly sensations in your limb. You're feeling that heavy breathing and your heart beating. Well, why is your body reacting in that way? Well, because your body is perceiving, not your body, I'm sorry, your brain is perceiving potential threat. Okay. And because your brain is perceiving this potential threat, it's just going to translate and trigger your body's autonomic nervous system to be prepared to respond to this potential threat. Except the truth is, whether you're perceiving the threat or it might actually be a false alarm, is up to you. Your brain can't tell the difference whether the threat is real or not. it only responds. So if you were the person who wanted to go skydiving and you're really looking forward to this, that might not be a threat, right? You might go, oh my gosh, I'm about to jump out of this plane. I can't wait. This is so exciting. And your body would still be feeling all of these tingly sensations. Your heart would still be palpitating. You'll still be breathing heavily, except you're perceiving this potential threat as adrenaline, as excitement. Whereas the friend who you invited might be going, I can't believe I let you talk me into this. And I don't want to jump out this plane because we're going to die, we're going to die, we're going to die. And your friend, who might not be your friend anymore after this, is really perceiving this as a true threat. Except both of you are feeling the same things physiologically. Remember, your brain cannot tell the difference whether this is a true threat or a false alarm. It simply responds to whatever it is that you're perceiving. So if you're perceiving this as what I call in my book, like this dangerous saber tooth, okay, then your body's going to respond with the interpretation of anxiety and fear and nervousness. However, if you're going to perceive this as excitement, then your body will respond with that adrenaline rush, that feeling of elatedness. So it really depends on what you're perceiving the threat as, or the trigger as, and then how you're channeling your energy depending on your intentions.
Yeah, I found that part super helpful. I'm not a parent myself, but it really related to my own anxiety as well. Like, I like the reframing of it. Like, your brain is just responding, but what you do with that information is sort of what the next step is. Yeah.
So, I mean, and I say this to a lot of the students who I work with who deal with procrastination, because same thing. You're feeling this fight or flight energy, and you can decide whether this means I'm too nervous to get my task done, or you could interpret it as, okay, this is just added energy because I need that energy to study for my final exam.
Yeah. And as we're talking about sort of this anxiety, how can this anxiety get in the way of the new mother and child attachment?
Well, I mean, that is hard to deal with. I would say that new motherhood is hard to deal with as is. And if you have added anxiety on top of the responsibilities that you already have, of course, that's going to interfere even more, especially if that anxiety surrounds intrusive OCD thoughts. It can disrupt the bond with your baby. So, for example, some common intrusive obsessions that new parents have has to do with potential accidental, whether potential harm to your baby, whether it's accidental, intentional, or even unintentional. So it could be, well, what if baby chokes if I feed my baby? What if baby drowns when I bathe my baby? What if I drop baby? What if I get frustrated and I shake my baby too hard? What if my baby dies during sleep because I rolled over baby, or because I didn't check on baby, or if baby gets wrapped up in blankets? So, potential harm. So, if I have this type of intrusive thoughts, then what I might do is not get close to baby, not feed baby, have someone else feed baby because I can't be responsible for that. Not put baby to bed, have someone else put baby to bed. Not bathe baby because what if I let baby drown? Certainly not hold baby because I can drop baby. So, even though I have the thoughts and I know that they're irrational, the feeling from it is just so intense that my approach or my go to response might be avoidance. So that would be the compulsion. It's the avoidance. Or I might constantly be checking on baby. I might constantly be looking in the baby monitor, or I might constantly be making sure that my baby isn't choking when I'm feeding baby, or I might be extra cautious during diapering or during bathing to make sure that nothing terrible is happening. Another type of intrusive thought that occurs commonly during the postpartum perinatal period has to do with sanitization, toxins, contamination, where the fear is, what if I'm not cleaning enough to prevent potential poison, to prevent potential toxins, to prevent germs and diseases for my baby? Or if I consume something, whether by breathing the air or by eating foods that might be toxic for baby, that might be contaminated, might have ill-born illnesses for baby. So therefore, I'm going to avoid all of this food, or I'm going to be cleaning extra. I'm going to be sanitizing extra. I might be compulsively checking the internet for information. This is very common with new moms. I'm going to be seeking reassurance from my partner, family members, other mothers, my pediatrician, my OB/GYN, and the compulsions can occur in that way. Another common intrusive fear that new mothers have can be something like, well, what if I make the wrong decision? So there is a lot of uncertainty about what is the right choice. There's a lot of difficulty in making decisions for the potential burden of making the wrong decision. So things related to feeding. What do I feed the baby? Especially for mothers who have a hard time with breastfeeding. Breastfeeding didn't come easy for me. And I remember during the first 3 days in the hospital, I was told that I need to start thinking about formulas. Well, during my perinatal period, my prenatal period, I did no research on formulas because I was certain I'm going to breastfeed. But then I had a really difficult time breastfeeding, especially supplying enough milk for two babies because I had twin boys. So I was driving myself crazy figuring out what formula. And then you have all of these FDA warnings or this warning and that warning of this formula label. So like a mother can drive herself nutty from doing all of this research. Making decisions about vaccines, that's a huge one, whether you have OCD or not. Making decisions about childcare, whether to put your baby in daycare or preschool early. So these are all the possible intrusive obsessions. And then the corresponding compulsions are basically, I'm going to check and check and check and check, research and research, Google all the time to get the just right, perfect answer, except that's really not how OCD works, because OCD thrives on doubt and uncertainty.
Yeah, and on the lines of uncertainty, you talk about there being a paradox of uncertainty. Can you say more about that?
Well, we all want uncertainty, except the only certainties that exist is death and taxes, according to Benjamin Franklin. And I think during the pandemic, we were pretty exposed to the real uncertainties of life. So the things that we do when we suffer from OCD is we are trying to do all of these compulsions in order to get at absolute certainty that the harm won't occur, that baby won't be harmed or die, that I am a good mother, that the decisions I make are the right decisions, except that's not the real world. There's nothing you can do that will build or create certainties in your life. And the truth is, we live every day being uncertain, and we're okay doing that. So I might ask you right now, do you know how your loved ones are right now? Do you know whether they're alive?
Nope.
No, you don't. You do not know with absolute certainty that your loved ones are alive right now. I do not know with absolute certainty that my kids are at school and they're well right now because I'm not tethered to them. Yet I'm still able to function. I'm still able to move through my daily responsibilities, knowing that they're probably okay. Probably. Yeah. And that's the paradox, is that we try to do these things to get at certainty, except the more we try, the more uncertain we actually are, right? Because what if? And that's what OCD does. OCD carries you down that worry train of what if. Well, what if I didn't check enough? What if I didn't protect my baby enough? What if I looked at my baby's genitalia a second longer than I was supposed to, and now I must be a pedophile? What if I washed my baby in a way that touched my baby in a sexually abusive way? What if I put my baby down in the bath and my baby drowns? What if my baby's crying is so annoying that I actually want to put a pillow over my baby? So a new parent will go through these intrusive thoughts, and then they will engage in the compulsions to try to get absolute certainty that everything will be okay, that the fears that I have will definitely not come true. And unfortunately, unless the topic is about death, which you will all certainly die, or taxes, which I don't know anyone who isn't taxed, the reality is trying to get at absolute certainty is an unfruitful use of your time.
I think your example of dealing with uncertainty throughout the day of like your loved ones is so accurate. Like I was, as you said that, I was thinking like I only am consciously stressing about one of my family members if they're like coming to me or leaving me. Like I'll think about their drive home or their flight home or any of that if I'm aware of their movement. But if I'm not, like you said, I'm probably like, oh, they're probably okay. And so with new mothers, they're constantly with their baby. And so they can't get away from that uncertain thought. So that makes total sense.
Right. And then also even like the intrusive thoughts surround a lot of things that you wouldn't really have information on. So like toxins. I mean, even if you had a microscope, you wouldn't know what toxins. I mean, do you know, folks, that we're constantly breathing in plastic in our air? Did we know that 20 years ago when we were still breathing in air, breathing in the plastic? We didn't know that. And now, just because we're more conscientious about it, still we can't see it, and we still breathe the air that we breathe, right? So it's like OCD wants you to know with absolute truth. And that's just not realistic. So then what happens is, because you have that gap between what you fear and what you want to close that gap, because that gap generates a lot of discomfort and distress, and you want the relief. So you try to close that gap. So the things that you do repeatedly is in the service of closing that gap, except you're just spending a lot of energy that new parents do not have, to try to get at certainty, which then robs you of the bandwidth and the sleep and the emotional resources that a new parent need, that then adds even more risk and vulnerability to having more intrusive thoughts. So you hear that vicious OCD cycle just going around and around and around and around.
We'll be right back after this short break.
Hi, I'm Dr. Daniel Fox, author of the Borderline Personality Disorder Workbook. When you first are diagnosed with BPD, or you're first told that you may have borderline personality disorder, it can be very frightening and overwhelming, because we have these ideas of what this disorder is, and you can feel trapped within it, trapped within this view or perspective of this thing that feels bigger than you and bigger than life. But the reality is that this is a disorder that can be managed, and that learning adaptive strategies can help you control it and do your life differently, so that you determine the course of your life, not your BPD. To learn more and to sign up, go to bpdcourse.com.
New Harbinger online courses, self-help for everyone. How can parents make room for that uncertainty, and what does that look like sort of in everyday life?
To make room for uncertainty, it means that you have to accept and tolerate that anything can happen. And even if it's not intentionally, baby can die. That's the truth. It's that it is the worst nightmare that any parent can have about their child dying. And even now thinking, right now, me thinking about my own twin boys dying. That just set off emotions that I wasn't prepared to come to this conversation with. But here I am with this emotion of, oh my gosh, how sad would I be? But that's the truth that we have to accept, is that our children can die before we do. And no matter what you do compulsively, it's not going to prevent their death. And I think that is the paradox that we have with OCD, is that we believe that if we check enough, if we seek reassurance enough, if we go and just to prevent the uncertainties of them dying by being tethered to them, that we would prevent their death. And you might prevent it by making sure that the crib is safe, that you don't have any dangerous things around, that you don't let baby around deep water. However, doing it repetitively is not going to change the reality that baby can still die.
Yeah. Yeah. One thing that you offer in your book is something called dedicated worry time, which I love the concept of. Can you talk about what that is and how it can be useful?
Yeah, we all worry, especially as a new mother, where especially if it's a firstborn, because you're unfamiliar with this new territory of parenting and caring for a helpless baby, you're going to worry. You're going to worry about every little thing. And the problem with just worrying is that it's like an IV drip into your body, and it's not contained. Whereas I say dedicated worry time because you're actually dedicating specific 15-minute periods during your day to just worry, do nothing except worry. So what I ask a lot of my mothers to do is to take out paper and pencil or pen instead of typing. I know we're in this digital era where everyone's just typing into their phones. No, when you're typing, you're using a different part of your brain than you would be if you were writing. When you're writing, it actually is a higher level of thinking and a different part of your brain that you're using. So for 15 minutes, set yourself an alarm. You're going to write out your worries. You're going to write, I am worried about my newborn, period. I am worried that my newborn will be harmed if I don't watch him all the time, period. I'm worried that if I don't put the baby monitor in the room, then I won't see when harm happens, period. So if you hear my statements, these are worry statements, and there is a beginning and an end. It's concise. It's got a period. And I differentiate that from what I call the ruminato, which is you're just swirling around like a tornado. Your worries are just nonstop, like a runaway train, where one worry flows directly into another, and there's no way of containing it. And that's not what you're doing on paper. You're not writing, I'm worried about my baby because if my baby dies, then it's the worst thing that can ever happen. And I will be a terrible mother, because what kind of mother would let their baby die and not be worried about their baby? And what are people going to think? And I will be suffering from this loss for the rest of my life, and I won't be able to go through with my life, blah, 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 blah. Right? That's a ruminato. And that's not what you're doing during a worry statement. So for 15 minutes, if you are conscientiously writing down the statements, then there are a couple of things that happens. First of all, if you run out of worries before that 15-minute is up, and for many mothers, that's what they say, I actually don't have 15 minutes of worries to write down, then you actually have to recycle your worries. Your pen or pencil cannot stop for that full duration of 15 minutes. And if you are able to write for the full 15 minutes, then you're externalizing your worries from your head onto paper. And therefore, it gives you material to work through, to process. And if there are certain worries on that piece of paper, it helps you to find more reasonable solutions. The other thing that happens is that you're no longer having that IV drip in your vein. You're pulling that IV from your vein. You're containing the worries to that 15-minute. And if you do have worries that occur during the day, you're going to tell yourself, I'm just going to wait till my next 15-minute worry time to worry about that. So rather than getting that drip of anxiety, drip of your fight or flight arousal throughout the day, you're just containing it to that 15 minutes, which makes your life, it gives you more bandwidth during the day to actually attend to the things that are required of a new parent.
Yeah, and like you said, it's separating it from yourself and also not trying to make you not think about, what was it, the yellow duck? Like, you're not telling yourself that you can't think that. You're like, okay, I'm going to prolong and I'm going to have my 15 minutes of dedicated time and then I'm going to get back to my life. So you're like making space for it without giving it too much power.
Absolutely.
One thing you talk about too is, obviously exposure is a very common treatment for OCD. What are some types of exposures that may be helpful for mothers experiencing this maternal OCD?
So there are two types of exposures generally. There are in vivo exposures, which basically means that you're going to engage in the exercises in real time. And then there are imaginal exposures, which basically means that you're going to be visualizing, imagining the possibilities. And exposures, what it actually means is that you are confronting your fears. And why is it important to confront your fears? Well, when you confront your fears, three things happen. Number one, you get the corrective feedback that what you feared wasn't that terrible to begin with. Number two, you get the corrective feedback that if it really was terrible, you were still able to tolerate it. And then number three, you gain confidence in your own ability to push through despite this terrible fear that you have. And the problem with not engaging in exposure therapy is that your go-to response would likely be avoidance. And the problem with avoidance is that when you avoid, not only are you not getting that corrective feedback, you're also empowering the fear with more strength. And that's the opposite of what we want to do. We want to empower ourselves and take that power away from the fear. And therefore, that's why exposure therapy is the evidence-based treatment for OCD and anxiety disorders. Now, some examples of in vivo exposure might be, I'm going to purposely look at the genitalia 5 seconds more during diapering. I'm going to purposely not sanitize my bottle 200 times. I'm going to hold baby, because I don't want to avoid. And then there are some exposures where you can't do it in real life because it's unethical, immoral, or illegal. So I can't ask you to stab baby. I mean, I can, that wouldn't be right. I can't ask you to smother baby or drown baby or stab or poke baby in the scalp where that soft area is. However, I can ask you to imagine it. So then what I would ask a lot of mothers to do is to prepare scripts, or, basically these stories about whatever the fear is that they imagine might happen, and then listen to it on an audio loop repeatedly. So these are different types of exposures. It might be exposures to your baby potentially dying of SIDS. It might be exposures to your baby suffocating from the blankets being wrapped around. It might be exposure to you sexually molesting your baby because you diapered them in a specific way. It might be you making the wrong decision and therefore harming your baby with certain toxins in their formula or their food. So these would be considered imaginal exposures. However, there's also the second part of ERP, exposure and response prevention therapy. So exposure tackles the obsessions. Then the response prevention part tackles the compulsions. So basically, remember, the compulsions serve to give you relief. Anything that you do to undo or neutralize the fear serves to give you relief. I feel better. Except anytime you get that relief, all it does is it reinforces your OCD cycle. So therefore, the response prevention tackles the compulsive, the things that you do, the compulsions, the things that you do to get relief. So if you are constantly checking 500 times, well, then I'm going to ask you to check once. If you are washing baby bottles and sanitizing them in a rigid way and then putting them in the sterilizer for like 2 hours, I might ask you to change that up. If you're constantly checking your memory bank, whether you've molested your baby or whether you've looked at the genitalia, too long, and therefore you must be a pedophile, I might ask you to change up your thoughts to something different. So whatever it is that you're doing compulsively to get the relief, the response prevention part is to change that up so that you're not getting that same reassurance.
Yeah. And as we've been talking, we've talked about sort of maybe the origin is partly hormones, this new life experience, but there is a part that is a lot of society's pressures. We've put you called it your perfect household disease, which I loved. And we talk about the super mom. So what has all this external pressure put on mothers, and how can they start to sort of break out of their pattern and reclaim who they are outside of being a mother? Because I think a lot of messages are that motherhood is your identity once you have a child. And so, yeah, what do you think about that?
Yeah, this brings up a recent review that I just saw from someone who must not be a mother, might not even be a woman, who basically dismissed the stressors that we get as mothers or that we go through as mothers. And what everyone has to realize is that OCD tackles whatever it is that you care about. Just because you're not having pedophilia type thoughts or you're not having intrusive thoughts of harm to your baby does not dismiss your OCD to be unimportant, that your OCD isn't as significant or as complex. So for all the mothers out there who read that review, and some has contacted me already who felt like their experiences have been invalidated by this reviewer, don't listen to that. OCD tackles whatever it is that you care about. So you might not care about being a pedophile, except you might care about being the most perfect mom. You might not care about dropping baby. However, you might care about the choices that you make as a mother that's going to cause harm to baby. So because there is so much guilt that comes with being a mother, not because of ourselves, but expectations, biased expectations from society that now we have assumed we believe that any flaw that we engage in, that we have, is going to translate to terrible consequences for our children, for our family. And therefore, we have to navigate through those belief systems that doesn't help us be a realistic mom, right? So like, I don't want to be a super mom. I don't want to be a superhero. I just want to be a loving mom to my children, one who prioritizes the safety and health of my children. And therefore, OCD might attack me in ways that might be different for another mom that is going through pedophilia type thoughts. So you have to not just take care of those deep-seated worries of potential harm, you also have to change up your relationship with the expectations of motherhood and your environment so that you're safeguarding it from further intrusive OCD thoughts. Which means if perfectionism is your thing, well, then we have to get rid of that thing. If making sure that all of the food is perfectly packaged correctly, or the ingredients are making sure that the ingredients are organic and gluten-free, whatnot, then maybe we have to break free from some of that rigidity. But just remember, whatever OCD tackles, it's because you care about it. Not because you're a terrible mom, not because you don't care. And doing exposure therapy doesn't mean that we're going to make you a terrible mom. It just means that we're increasing your awareness of your values as a mom. And we're aligning your behaviors according to your values as a mom. I am sure many mothers out there listening to this, or fathers, don't really want to be spending hours doing chores to perfect their home, don't want to be spending hours to make home cooked meals just so that you can say, I provided my children with nutritional value. However, you still do. Well, why do you do that? Right? So we have to break free from our perfect household disease by recognizing what is really important to us as parents, as a mother. And the behaviors, we have to change up those behaviors so that it aligns more with whatever it is that we truly care about, with whatever it is that is truly meaningful to us. And if the two are incongruent, then that's where guilt occurs. And guilt is the perfect ingredient, the perfect fuel for OCD to thrive. So we have to lessen the mom guilt. We have to lessen the perfectionism. We have to lessen the unrealistic expectations of ourselves. Even though society expects mothers to be everything and everywhere and do everything, we can't hold that up realistically. It's not tenable. And then when we fail to do that because it's not that type of bias and expectation isn't sustainable, we are quick to blame ourselves for being imperfect, for being not good enough. And then that is what breeds more intrusive OCD thoughts of what a terrible mom I must be. So yes, we have to hit directly onto those intrusive thoughts that occur. However, then after that, we also have to make sure that we embrace an environment and our relationships that are conducive to maternal wellness.
Yeah, Dr. Yip, that feels like a really powerful note to end on, unless you have any final thoughts for the listeners.
I think I've said many things. I can talk about this for hours and hours. And, I will be resuming my podcast, The Stressless Life, about this topic.
Amazing. Thank you so much for your time today. I know a lot of people are going to get so much good information from your book and from this conversation. So thank you.
Thank you for having this conversation with me.
Say goodbye to anxiety, OCD, and alarming thoughts with this compassionate guide for new moms as you welcome your baby with a warm hello. Motherhood is one of the most difficult and demanding jobs to exist. It has led many women to physical exhaustion, mental fatigue, emotional rage, and ultimately chronic burnout. The expectation to be everything to everyone and be everywhere all at once requires mothers to give and give and give until there's nothing left to give. Yet despite the challenges that naturally come with mom life, new or seasoned mothers are rarely prepared for the endless worries, spiral of anxiety, or frightening intrusive thoughts that disrupt this critical bonding period with your loving baby. Add perinatal mental health conditions like postpartum depression, anxiety, OCD, or psychosis to the mix that is even less talked about, and you have the perfect storm for maternal unwellness. Hello Baby, Goodbye Intrusive Thoughts offers evidence-based cognitive behavioral therapy and exposure and response prevention strategies to stop the spiral of anxiety and alarming intrusive thoughts so you can spend less time in your head and more time connecting with your child. Jenny Yip not only understands and treats anxiety and OCD, she has battled her own postpartum OCD with the birth of twin boys. Now in this groundbreaking book fueled by a lifetime of professional dedication and personal insights, Yip delivers the essential guide that has benefited countless patients and mothers under her empathetic expertise over the past 2 decades. Whether you're a new or seasoned mom, Hello Baby, Goodbye Intrusive Thoughts provides a toolbox for all mothers to worry less, stress less, and do less of mom guilt in order to get back to what truly matters to you, baby. Enriched with practical step-by-step exercises, heartfelt stories from moms across the globe, and the latest scientific research, you will discover strategies to grasp what drives your anxious thoughts and behaviors, embrace uncertainty to engage more authentically with baby, disconnect from the worry train that interrupts your bond with baby. Build a flexible mindset to mitigate the negative mind traps that disengage you from your baby. Let go of perfectionism and mom guilt to restore maternal and baby wellness. Establish mental, emotional, and physical boundaries to ease the invisible demands of mom life and honor your motherhood identity. Create a lifelong stress-less habits that better serve your sanity and growing family. By practicing the habits that will nurture your bond with baby, you too can reclaim wellness on your motherhood journey with Yip's humble and compassionate tested approach. Visit our website at www.newharbinger.com and use coupon code PODCAST25 to receive 25% off your entire order. New Harbinger Publications is an independent, employee-owned publisher of books on psychology, health, spirituality, and personal growth. For over 50 years, our evidence-based self-help books and pioneering workbooks have helped readers make positive changes to improve mental health and well-being. Founded by psychologists Matthew McKay and Patrick Fanning, New Harbinger is proud to be an employee-owned company. Our books reflect our core values of integrity, sustainability, compassion, and trust. Written by leaders in the field and recommended by therapists worldwide, New Harbinger books are practical, accessible, and provide real tools for real change. The best continuing education training does more than just fulfill requirements. It opens your mind to new possibilities, increases your confidence, and gives you powerful tools to transform your clients' lives. Praxis Continuing Education and Training partners with world-class experts to create cutting-edge, evidence-based courses for mental and behavioral health professionals. Learn how to heal trauma with Robin Walzer, explore values with Kelly Wilson, and master the basics of acceptance and commitment therapy with Matt Boone through an on-demand course. Or join experts and like-minded professionals live to take your practice to a new level. Find your next training opportunity at praxiscet.com. That's praxiscet.com. Do you have an idea for another episode? Do you want to send us a message? Our email address is podcast@newharbinger.com. We'd love to hear from you. This podcast was edited by Jesse Fancushion. If you enjoyed today's episode, we'd love if you rated, reviewed, and subscribed to the show, and we hope that you might share it with anyone who could benefit from the content. This podcast is not a substitute for counseling with a licensed provider.